Dr. Jones. My name's Danielle. I'm going to be your nurse today. I'm here because we're going to be doing 6 milligrams of morphine intramuscular, 1 dose. I'm going to go ahead and pull the patient's curtain for privacy. I'm going to go ahead and verify the 6 rights of medication administration. I'm going to verify the doctor's orders, 6 milligrams of morphine IM times 1 dose. Perfect. Can I go ahead and verify your wristband? I'm verifying 2 patient identifiers. Jimmy Jones and your date of birth. Perfect, thank you. And before we get started, do you have any allergies, any food, medication, or environmental allergies? No? Perfect. And do you have any questions before we get started? No? Okay. I'm gonna go ahead and hand hygiene. I'm gonna put my clean gloves on. And I'm gonna verify the medication in the Mars for the 3rd time. 6 milligrams morphine IM, 1 dose, perfect. So I'm gonna go ahead and draw up your medication and then we'll go ahead and get started, okay? So I'm gonna go ahead and pull back 6 milligrams. 6 milligram. I'm gonna clean the top of the vial with a cotton swab. Okay. I'm gonna insert the air into the vial. Then I will invert and draw out 6 milligrams. And I will recap and put it down until we are ready to go ahead and inject. So for now, I'm gonna go ahead and just palpate. We're going to be using the vastus or ventrogluteal, site. If we weren't able to do it there because of bruising or edema or inflammation, I would go ahead and choose another site such as the vastus latissimus. And I'm palpating to see any edema, inflammation, or tenderness. Patient isn't confirming any tenderness or anything. So I'll go ahead and do it there, no bruising. So I'm gonna take the heel of my hand over the greater trochanter of the hip with my wrist perpendicular to the femur. I'm going to point my thumb towards the groin and my index finger is superior to the iliac crest. And then my middle finger is along the iliac crest towards the buttocks. And I'm going to form a V triangle here. And inside the V triangle is where I'm going to go ahead and inject the morphine. And I'm going to clean the site in a circular motion. I'm gonna let that dry, and after I've cleaned the site, nothing else can touch it or contaminate it. It's going to go ahead and dry. I'm gonna hold gauze in my other fingers. I'm gonna remove the cap with my thumb. And I'm gonna hold the syringe like a dart. And I'm going to have the patient relax where I'm going to inject. I'm gonna pierce the muscle at 90 degrees. And I'm gonna pull back the plunger with my hand and just be sure I'm not drawing out any blood to make sure I'm not hitting any artery or vein. No blood is coming out. And you pull back the plunger for 5 to 10 seconds. And if no blood, then I'm gonna go ahead and insert at 10 seconds per milliliter. Okay. Perfect. perfect. I'm gonna go ahead and recap and just go ahead and use that gauze I had in my finger, hold over the injection site. And then I'm going to go ahead and place the needle into a sharps container. Into a sharps container. I'm gonna go ahead and remove my gloves and use hand hygiene. From hand hygiene, I'm gonna go ahead and document in the Mars system of what I just did. Also, I did not recap the needle. I discarded the needle and syringe into the sharps or puncture-proof container. And again, I'll document into the Mars system what I just did.